welcome to today's InstaLive, and today I'm calling you from the beautiful Algarve, where I'm taking a week of holidays, but I still wanted to continue with my InstaLives. And today I am going to talk about sperm analysis. And so often we talk about all the problems, the female problems, the treatments that are done on women, and I feel that we don't talk about enough about men and what tests men can do, what problems can cause male factor infertility. So it's important to talk about men, and it's important to know that men should be evaluated from the start. When women are referred to a fertility appointment as part of a couple, an heterosexual couple, men should be examined as well, a physical examination. They should be present when the doctor is asking questions about their sexual activity, about their trying to conceive years. So it's important to go through a medical history, a physical examination, and to do some basic tests to start with, not only on women but also on men. So it's really, really important that men are part of the process. And the sperm analysis really is one of those first tests that men need to go through. So we know that male fertility seems to have been worsening throughout the years, and it has been worsening at a rate of 1.7% a year for the last 10 years, which is quite drastic. So it looks like men today are more infertile than their grandparents or their great-grandparents were. So there is a problem with male infertility. It seems to be worsening. We don't know yet what might be causing this worsening of male fertility, but it looks like it might be related to environmental factors, food that we eat, things that we are exposed to in our environment as well, and also again certain habits that maybe young men have these days that maybe their parents and their great-grandparents didn't have at the time. The matter is that it's worsening. So sperm analysis is one of those first investigations that men need to go through. And so let's talk about what sperm analysis actually looks at. A sperm analysis will look at the number of sperm that are in that sample. We'll look at the shape of sperm. Sperm has to have the head, the little nucleus. It has to have the tail. So it will look at the shape, because so many times men will have sperm that don't have the correct shape, or that have two tails, two heads, whatever. So it will look at the shape, and it will look at the movement as well, because sperm needs the tail to move in order to go up the vaginal canal and go through the uterus and meet the egg in the fallopian tubes. So if sperm is not able to move properly, then again is not able to fertilize the egg. So it's going to look at these three most important topics: the number, the shape, and the movement of sperm. So how do you prepare for a sperm analysis? Well, if you are listening and if you have had a sperm analysis already, or your partner has had a sperm analysis, you know that current recommendations are advisable to not to ejaculate from 24 to 72 hours before the collection of sperm for analysis, to avoid alcohol, caffeine, drugs 2 to 5 days before the test, and to avoid any hormonal medications as instructed by your doctor in preparation for the sperm analysis. The sperm collection is usually through masturbation in the clinic. Clinics have rooms that are specific and have been prepared for this kind of collections. So they are very private, even though this can be quite a very stressful time for men to go through in the clinic. But the rooms have been prepared with a relaxing environment. They have some magazines, some videos, so it can help them collect a sample in a clean, sterile cup ready to be analyzed. However, sometimes it might be that men are not able to collect it in that way in the clinic, so they can collect it with a special condom. It's not one of those condoms that we can buy off the pharmacy. It needs to be a very specific condom that doesn't have any lubricants or any material that kills the sperm. Sperm collection can also be made via ejaculation stimulated by electricity in some severe situations, but the majority of cases will be through masturbation in a clinical setting and to a sterile cup ready to be analyzed. Now, when we look at the results from sperm analyses, these results will show a range of what is normal, and these ranges of what is normal were determined by the World Health Organization in their 2010 guidelines. So they explain what is a normal semen sample, and virtually all clinics should present their results in accordance how they relate to the World Health Organization 2010 guidelines. So you can see here on the screen what the reference limits are for each of those parameters that are evaluated. And I would like to go one by one. So the first one is the volume. So this is the amount of semen that is in the cup that is being analyzed. And the minimum would be 1.5 milliliters of seminal fluid. So we know that if the volume is lower than 1.5 than is expected, it can be for several reasons. One of them is an obstruction in the vas deferens. This is the duct that carries the sperm from the testicles to the urethra, which is the tube that goes along the penis that also brings urine, and it brings semen as well. So if there is an obstruction in that vas deferens, the volume can be less than 1.5. Sometimes there can also be an absence or a blockage of the seminal vesicle. Some men have partial retrograde ejaculation, which means when they ejaculate, instead of having semen coming out of the penis, it goes up into the bladder. So it can happen as well, and it would result in the lower volume sample. Or it can also be because of a hormonal imbalance. Now, the next parameter that you can see here in this image is the total sperm count. So this is the total number of sperm that are present in the semen sample. So semen is the fluid, and semen will have sperm inside, which are the cells that will fertilize the egg. So a normal value here would be about 39 per ejaculate, and this is considered the average value that would be normal. If you have a lower value than this, a lower than normal sperm volume, total sperm count, this is called oligospermia, or even azoospermia if there is no sperm cells at all. So if you have no sperm cells in your semen, then there's no chance of the egg being fertilized by your sperm. If you have less number of sperm in your ejaculate, then it would be called oligospermia. So if you have seen these names, oligospermia or azoospermia, they will be related to the number of sperm in the semen. Now, the next item that is here in the table, you can see sperm concentration. This is the number of the sperm cells that are found in 1 milliliter of semen. And the normal value is at least 15 per milliliter. When we have a low concentration, meaning in that milliliter we don't see as many as we were expecting to see, this is usually part of an overall low sperm count. It's likely that in the rest of the sample it's also a low number of sperm. And it could be related to an abnormality that needs to be looked into as well. The next item that you see here in the table is the total motility. And motility refers to movement. Remember that in the beginning we were talking about the movement of sperm and how the tail is really important to allow the sperm to navigate through the vaginal canal, through the uterus, into the fallopian tubes where it meets the egg. Well, movement is really, really important. And it's usually described as a percentage, and they are categorized into 4 groups depending on the speed of sperm and the direction of sperm. So you have rapid progressive sperm, are sperm that are moving forwards very quickly. So when the embryologist looks at in the microscope, this is what he would see: sperm that is moving forward very quickly. The second category is sluggish progressive sperm that are moving forward, which is good, but they are slower. Then you have non-progressive sperm that move in circles or on the spot. This is not good, so they're not moving forward, they are just moving in circles. And then you have the fourth category, which is immotile sperm that doesn't move at all. So here the normal value would be more than at least 40%, and they must move normally an hour after ejaculation, and at least 32% should swim in a forward movement or in large circles as well. And we have here the next item. We have vitality or viability, refers to the percentage of live sperm in the semen sample. So these tests will use a special stain that will only enter the sperm if they have damaged membranes, so the outer part of the sperm. And if the stain enters the membranes and the sperm, they are classed as dead. And this is only usually performed if there is any evidence that there is a large proportion of sperm that are not moving from the previous motility assessment that we were talking about. So a normal value would be at least 58% of sperm cells should be viable, so they shouldn't allow the stain to go through. Now the next one we have here is morphology. So morphology refers to shape. And again, remember I was saying in the beginning that there is a certain shape of sperm and there's several abnormalities that can happen. So here we're looking at how the sperm looks like when it's being seen through the microscope. So you should have the head, the midsection, and the tail, and these are all evaluated and measured, and the proportions between them are taken. And the normal values, again, according to the World Health Organization, are at least 4%, should have the normal shape. And so we have here the next factor that I would like to tell you about is called liquefaction. This is when the semen is ejaculated, and it's usually thick and gelatinous, and to help it adhere to the cervix, because not all the semen that is ejaculated will be able to go through the cervix. Actually, it's just a very small percentage of sperm will. But here the normal value would be semen should liquefy within 20 or 30 minutes of ejaculation. And if there is any delay in this liquefaction, there may be a problem with the prostate, the seminal vesicles, or the bubourethral glands. And the last point that I would like to tell you about is the pH of semen. This is a measure of how acidic or how alkaline the semen is. And the seminal vesicle fluid should be more alkaline, while the prostate fluids should be more acidic. And in combination, they balance each other out in the semen. So if you have semen that is too acidic, it may kill the sperm and prevent fertilization. So here again, normal values the semen should have a pH that is greater than 7.2. But at the moment, there isn't really a consensus on how more alkaline semen may affect fertility, but it's something to look into. So the key takeaways of today of this InstaLive is that semen analysis is a very important test. It's one of the most basic tests that men should do, and it should be proposed even during those initial basic tests, even by GPs or even in the first fertility appointment with doctors as well, because around 40% of fertility problems in couples are related to men. So definitely something to look into. Not only the sperm analysis, but like I said in the beginning, you need to look into a medical history of men as well as women and a physical examination, because there are several anatomical problems that could result in changes in your sperm analysis. So it's definitely something to look into. I hope you enjoyed today's InstaLive. I'm going to leave it on IGTV for everyone who wants to watch it from the beginning. And I'm going to go back to enjoy the beautiful Algarve. I've been here for a week on a much needed vacation. And if you haven't done so yet, you need to go through the link in bio, because I have an amazing app coming in November 2020. I've seen the first screenshots today and it's absolutely beautiful. I promise to share some by the end of the week. And it's going to be mostly free to everyone. It's my way of giving back to this community. If you want to have early access, all you need to do is go through the link in bio and subscribe to the link, and I will tell you more about it in a few emails coming up after. Hope you enjoyed it. Thank you. See you shortly.